Hi, I'm Liz Reid. I'm from Princess Alice Hospice in Esher, and I'm going to talk about a survey which is part of a portfolio of research. It's a partnership between Princess Alice and the University of Surrey. About just over a year ago or so ago, we applied for a research grant looking to develop an intervention for patients who are parents of young children. We define young with the UN definition, which is under 18. And we didn't get the grants, and what they said was, what do we know about hospice provision for, try and stand so you can't see me. What do you know? What do we know about UK provision for families? And actually we didn't know an awful lot. So we did a national survey of hospices in the UK. So this is really a snapshot of that. We haven't published it yet, it's about to go to application and inform our next steps. But this is a snapshot of the survey. So a bit of background. In the UK, a parent dies leaving dependent children every 22 minutes. And an estimated 41,000 children under the 18 were affected by parental death. And so you can see from these statistics, 4.7% of young people who have experienced the death of one or both parents. It is a significant problem, but it isn't necessarily something that we think of when we first think of palliative care in adults. What we do know is that children do need support, and they're often the invisible part of parental death when their parent dies. Often the focus is on the parent rather than on the child or the family. And we know that children as adults can have long-term psychological morbidity and challenges which can be lifelong if their needs aren't met when their parent approaches death and afterwards. So those that lack suitable support and transparent communication, often children are slightly invisible in this process, and people would prefer not to address it because it's such a difficult issue. And often a surviving parent is struggling to cope with their own emotions and coping with their partner's death. So the relationship between them and the child and how they support their child can have a significant impression on how the child copes afterwards. And we know from a lot of work that's been done before, the majority of children, not the majority, but a significant number of children are unprepared for the parent's death. And we know that children, if you work in palliative care, you know this, I'm not telling you anything new. They need to be given timely and age-appropriate information in languages they can understand, and as we all know, they can ask really difficult questions when you least expect it. And different ages have different needs, and being responsive and knowledgeable about what those needs are and supporting parents in having those conversations. They need to be able to express their thoughts and fears and to have those fears and anxieties addressed, not necessarily relieved because it's an incredibly difficult thing to go through, but at least have them expressed. So we decided what we needed to do was find out, so what is out there? There's little data exists on how hospices provide support for families or what their contribution is to this client group. And considering there are like 200,000 plus patients under 18 experiencing this problem, we wanted to examine the current status of services provided by UK hospices for families and how that will inform our next steps for research. So this is kind of hot off the press. So we did an online survey of all hospices that we had access to from the UK hospice database around the UK, and we had pre and post. We asked questions about pre and post parental death, what types of services, who delivers the services, who receives their support, and where the support is delivered, and about how do you identify children, and inquiring about children in the family, and where they are, and support the staff as well. And what challenges the hospice face in providing this type of support. So we had a pretty good response rate of 197. There's over 200 hospices, so we had to exclude, of course, the children's hospices. And there are, I think, over 200 adult hospices, but we had names, we had to identify the contact details ourselves, 197 hospices. So all regions around the UK were represented, 66% response rate. And just over 10% of those are community-based purely without an inpatient unit. So we're going to look really at the settings of support, starting from the top. The arrow going down indicates the proportion of respondents providing support in each setting as it goes down, you can see from the table. So what we know is virtually all hospices provide support pre and post-death. Some, but very few, offered remote support, like electronic, FaceTime, Skype, and they tend to be obviously in the more rural settings. Most services were offered, more likely to be offered post-bereavement rather than pre-bereavement for families. So when we asked about who you provide support for, I haven't got a table for that. 75% they offered children specifically support beforehand and 75% after. So 25% of hospices didn't provide support pre and post death of their parents. But most places were offering a fairly comprehensive support. But you can see from this table things like running support in community locations was lower, as was web-based material, etc. We also asked them about who provides the support, and I was quite surprised that counsellors came out highest. It'd be really interesting to understand what hospices provide more support through professional counsellors, because as a hospice, all our family care comes from the community nurses and our specialist social workers. So we don't actually have any counsellors specifically. And we asked what sort of support services, and again, you see the table at the bottom with the lowest provision of support. Most were able to offer written material, signposting to the organisations, and almost all provided, I think around 89%, one-to-one face-to-face support pre and after and post-death. As you can see, less pre than post. Providing resources such as CDs, DVDs, that kind of thing was very low, and later you'll see that resources turn out to be a significant problem for services trying to support this client group. So I don't know what databases you use, but in our hospital we use Crosscare. Does anybody else have Crosscare as a way of patient notes, electronic notes? But 20% of respondents said they didn't have a formal process of identifying and recording children, and I know it from us. If you want to record a child on Crosscare, you have to put their date of birth down, and our community nurses think actually in the first or second visit that can be a bit intrusive, so they're less inclined to do that. So that means they're not flagged on the system at all. They're already invisible to us at quite an early stage in our intervention with them. 20% didn't provide support for staff on how to have these really difficult discussions, and I'll talk a bit about the other work that we're doing in another part of this research in how to support staff. So we asked a lot about challenges. What challenges did they have? And that was a real difficult emotional conversations with parents and children, and that professionals and parents alike were reluctant to have these conversations with their children because they're so difficult, and nurses in particular were frightened of the can of worms, making matters worse with the kind of statements that were said. On the other part of what we're doing is we have a joint PhD student who's at the moment doing work on interventions for health and social care professionals in supporting and communicating with families as well. So parents also told us through Penny's work that they really want health professionals to support them to have these difficult conversations, but that's not generally happening. We asked them about the practical and social difficulties, and what often happens in palliative care, as you know, they're referred very late to palliative care services. So you have a very finite time to help these parents prepare their children for the death. And what parents have told us in the other part of our research is the surviving parent feels hands are tied by the dying parent, who doesn't want to talk to their children, and they don't want us to talk to their children, making it incredibly difficult for the surviving parent and the health and social care professionals to communicate and prepare their children for their death. There's also other practical and social difficulties. We know from work done elsewhere, David Kassane's work, that families who are dysfunctional or chaotic are less likely to be able to work with health and social care professionals to prepare their children, or have any way to communicate on a structured way with their children, making it really challenging in some areas to talk to children and prepare them. And somebody in our survey said they worked in a very socially deprived area and this is a constant challenge for them. And this came out loud and clear. Funding and resources, staffing and funding for DVDs, written material. And I was really surprised about the amount of people who were saying, because we asked the sign of, the people that responded tend to be the person who was responsible for this service, either a director of service or a senior social worker. That constantly having to seek funding for things like booklets, books, leaflets, that kind of thing, and staffing, and the training and the education for staffing, which we know education budgets are increasingly challenging at the moment, and making sure the staff are ready for these were really challenging. And that fits into the final part. The challenge is having staff who are competent and confident to have these really difficult conversations. That's with the parents, but also with children, struggling to, while we're used to talking to adults, we're less used to communicating with children. And for the health professionals, that's a real struggle. Then again, finding the money to ensure all your staff are competent in this really difficult, emotional, challenging time was a significant issue. So the other element to what the research portfolio we're doing, if we have Penny, who's a PhD student, and she's doing a co-design approach to education for health and social care professionals around the exact thing. And at the moment we're developing an educational intervention to look at how we can support palliative care and general nurses to have these really difficult conversations with patients and their children. So that's where we are at the moment. To summarise, the important things are there's recognition and acknowledgement of need. They are quite invisible in our care and it's really easy to let that continue. So we want to try and highlight and look best ways to support our staff to have these difficult conversations. No family is ever the same. There's a diverse needs. It can be social, cultural, and all sorts of multitude of different reasons why no family is the same, and it's learning to how to manage the way they communicate and help them to support their children. We're not looking to talk to their children ourselves. What we want to develop is something so you can help parents to prepare their children for their death, to work with them predominantly, obviously as a patient, pre-death, so that their bereavement is planned, they're better prepared for the death of their parent. There is a real difference in services across the UK, some offering much more comprehensive services than others, so maybe we need to look at that. And certainly, as I said, there's much more support post-death than there is pre-death, and our focus is on preparing children before the death and the surviving parent, because they're the ones that are left with the chaos, if you like. And in my previous role, I worked in advanced breast cancer, and I often had really difficult conversations with husbands who were struggling to cope with children with extreme behavioural problems. And one of the issues I think which is challenging, increasingly challenging, is there are so many treatment options for certain cancers out there. So patients can get a period of decline and reprieve, decline, reprieve. So they're travelling this roller coaster, and their partner and their children are travelling that with them. And they seem to recover a few times. They have another chemo. Whether their survival increases is another debate altogether, but what they are having repetitive treatments, and the quest for treatment is obviously becoming more of a focus potentially than actually preparing for end of life, and that's a real challenge in today's healthcare. Parents are reluctant, as I said, to prepare their children about impending death for all the right reasons. They don't want to upset them, they don't want to blight their childhood, but actually preparing them is really, really important. Professionals certainly lack a lot of confidence in facilitating difficult conversations and opening what they refer to as the can of worms. Insufficient education for health professionals, and of course increasingly a lack of funding as well. And the lack of resources for support for families, that's the staffing with the skills and the knowledge, the education, but also the specific staff to do this, but also resources that people are constantly chasing to have booklets and leaflets and resources for families to take away. So that's where we're up to at the moment. We've just finished this, to say, hopefully we're going to publish this in the next month, within the next month. And then we're applying for a larger grant. And the larger grant is going to develop an intervention, or we hope, some form of intervention for parents. So how health professionals can support and prepare parents